A very good morning to one and all. Today we are discussing with another topic, that is mastoiditis. That is also comes under ear disorder. Let me discuss about the definition. It is an inflammation of the mastoid process behind the ear and of the air space connecting it to the cavity of the middle ear. So, what do you mean by mastoiditis? It is an inflammation of the mastoid process. You can see in that behind the ear, you can see a projected part. You can see in the picture. You can see. Otherwise, you have to refer the anatomy and physiology. A small projective area. You can see. You can feel that area. That is called the mastoid process. This process will help for bone conduction. Okay, sound conduction is taking place in two methods. One is bone conduction and another one is air conduction. So bone conduction sound transformation is occurring with the help of this mastoid process. So any inflammation occurring in the mastoid process behind the ear and of the air space connecting it to the cavity of the middle ear. So from the inner part of the mastoid process, it is connected to the middle ear with a air cavity. So the vibration also will be absorbed and it will be conducted to the inner ear for sound transmission. So that is called mastoiditis. So once again I'll read that definition. It is an inflammation of mastoid process behind the ear and of the air space connecting it to the cavity of the middle ear. So you can see in the picture about the mastoid process, mastoid bone you can see, and there is an air passage is there that is leading to the mastoid process to the in middle ear. Okay, so that is called mastoiditis. Let us see the causes. Otitis media, we have discussed last day about otitis media. It's in infection or inflammation of the middle ear. It can lead to mastoiditis. Then CSOM is nothing, chronic suppurative osteitis media. So that is a type of otitis media, chronic suppurative or otitis media. Then inadequate drainage of exudate in otitis media. So during the treatment or during otitis media, if the fluid is not properly drained out from the middle ear, it can lead to mastoiditis. Then inadequate treatment of AOM. AOM means acute otitis media. So proper treatment is not giving for acute otitis media. It can lead to chronic otitis media and also mastoiditis. Then cholesteatoma. So it's a non-cancerous skin, non-cancerous growth which is taking place in the middle ear. It's a skin cyst. Okay, cyst formation, growth formation is there in the middle ear, may block drainage of the ear. Okay, so because of cholesteatoma or growth in the middle ear can lead to obstruction in the mastoid process can, and afterwards infection can occur. So these are the causes. Let us see the types. Mainly it is divided into acute and chronic. And in the acute there are two types are there: catarrhal mastoiditis and coalescent mastoiditis. Catarrhal mastoiditis and coalescent mastoiditis. We'll discuss in we'll discuss it. First of all, acute mastoiditis. It is a rare complication of acute otitis media. So, acute mastoiditis means rare complication of acute otitis media. It is a complication of acute otitis media. In that, we have seen that catarrhal mastoiditis. This stage follows the stage of suppuration in acute suppurative otitis media. There will be congestion of the mucosa of the mastoid which lead to aggravation of symptoms. So catarrhal mastoiditis is occurring as a following of acute or suppurative osteitis media. Okay, due to acute suppurative osteitis media, or it's a complication of acute osteitis media, the catarrhal mastoiditis is occurring, and this is happening when there is a congestion of mucosa of the mastoid which lead to aggravation of symptoms. So when the mucosa is congested inside the mastoid process, that can lead to catarrhal mastoiditis. Then coalescent mastoiditis. The air cells of the mastoid coalescence and mastoid cavity becomes converted into a bag of pus. So what is happening in coalescent mastoiditis? The air cells of the mastoid coalescence and mastoid cavity. So inside the mastoid cavity, air cells you can see. You just go through the anatomy or physiology of ear. So in the picture or in the diagram, you can see in small spore-like or holes you can see in the mastoid process, that are the air cavities or air cells. Okay, so these air cells will be converted or replaced by pus. Okay, so if pus formation is seen in the mastoid cavity, that we can call it as collagen mastoiditis. Then chronic mastoiditis, it occurs with chronic suppurative otitis media or with cholesteatoma formation. So chronic mastoiditis, how it is occurring? Due to chronic suppurative otitis media or cholesteatoma formation or skin growth or cyst formation. So this is all about types. Let us see the picture. This is acute mastoiditis. So now I think you understood about the mastoid process. And chronic mastoiditis, there is some more changes. You can big swelling will be there and more redness, and there's a necrotic changes you can see. Then pathophysiology, as I told you in the beginning, the main cause for mastoiditis is non-treated otitis media. Okay, so here also etiological factors they have mentioned here: otitis media or cholesteatoma due to skin growth or a cyst formation. Cyst can obstruct the cavity. Okay, that mastoid cavity. And otitis media, during otitis media, the infection can spread to the mastoid process. Inadequate leads to inadequate drainage of exudate. The exudate is not draining out properly. Spread of exudate into mastoid air cells. So as we seen in the collagen mastoiditis that air cells will be replaced with pus cells. So here also the exudate will spread in the mastoid air cells. Extension of infection to mastoid air cells, then congestion of mucosa of mastoid bone, pus collection in mastoid air cells that can lead to aggravate of symptoms. So this is happening in mastoiditis. So due to the complication or non-treated otitis media or cholesteatoma, it can lead to inadequate draining of exudate from the middle ear, can lead to spread of exudate or pus into the mastoid air cells. So extension of infection can occur. It will affect the mucosa of mastoid bone. Okay, in the mastoid bone also mucosa is present. The mucosa will be affecting, and there is more pus collection you can see in the mastoid air cells, will lead to severe earache, ear discharge, and swelling, inflammation. Okay, this is about pathophysiology of mastoiditis. Let us see the signs and symptoms. Severe pain in the mastoid region behind the ear. The person who is experiencing have more pain. Then redness in the mastoid region, as we have seen in the picture. Swelling in the mastoid region. Tenderness in the mastoid region. Otalgia, earache, feeling of fullness. Oral pressure will be there because of the collection of pus inside the. This is a closed chamber, so inside the mastoid process, if pus formation is there, that can lead to heaviness or fullness. Then perforation of eardrum, then fever, dizziness, otorrhea, ear discharge, and deafness. So these are the possible signs and symptoms you can see in mastoiditis. Understood? Let us see the diagnostic measures, or what are the diagnostic evaluations. History collection, you have to take the proper history of the person. So here you have to collect the recent medical conditions. So then only we can identify whether they are having any acute or chronic otitis media or cholesteatoma. So collect the proper history. Then physical examination should be done. So what are the signs we have discussed? That signs we have to assess on the person, whether swelling, redness, tenderness, ear discharge, these all things you have to assess. Then mastoid bone X-ray. So it will help to evaluate the extension or the exact location of the infection. CT scan also helps to evaluate the structures inside the mastoid process, where or how much it is extended, how much severity is there, whether any adjacent organ is affected, whether there is any involvement of brain. Then complete blood count and blood culture will help to identify the severity of infection and also the causative organisms. Then tympanocentesis. So with the help of tympanocentesis, we can collect the fluid from the middle ear, and it will help for identifying the underlying disease condition or the organism which is lead to mastoiditis. Then audiography, it is a graphical representation which helps to study the hearing loss. Okay, whether the person is can able to hear properly or how much effectiveness is there. This all things you can assess through audiography. Then lumbar puncture, it is another diagnostic evaluation in case of chronic mastoiditis. that time there's a chance of brain involvement because the mastoid process also extending to the brain. So and from the mastoid process the infection can spread to the brain. So in that condition, if there is any suspicious symptom, then we have to go for lumbar puncture. So in the CSF, if there is any presence of infection that we can identify through the cerebrospinal fluid, so that will helps to prevent more complication of central nervous system. So these are the diagnostic measures. Then let us see the management. First of all, medical management in that antibiotic for infection and inflammation. So systemic and topical antibiotics we can provide. Systemic antibiotics either it is oral or IV, and topical antibiotics means we can provide ear drops. So example Ciplox D, tetracycline, cephalosporin. Then analgesics, because person is having more ear pain or earache will be the otology will be there, and also irritations will be there, so we have to provide analgesic. Then systemic decongestants like phenylephrine hydrochloric acid, so it will helps to reduce the obstruction in the ear. Corticosteroids helps to reduce the inflammation. Antipyretics, because infection and inflammation is going in the ear, so there's a chance of increased temperature or fever that can be treated by antipyretics. Then ear irrigation, that's a non-pharmacological management we are doing. It's a procedure. It will helps to remove purulent discharge from the ear. Okay, we have discussed in the previous classes about ear irrigation, so I think you understood about ear irrigation. So these are the medical management for mastoiditis. Let us see the surgical management. What are the surgical management for mastoiditis? First of all, mastoidectomy. So mastoidectomy means, I think you are clear about this one. It's a removal of the mastoid process. So here it is a surgical procedure that removes diseased mastoid hair cells. So here not entire mastoid process, the disease cell where it is affected, that particular cells we are removing. So it is of simple, radical, and cortical. Three main procedures are there for mastoidectomy. Let us see in detail. Simple mastoidectomy means the incision is made behind the ear to remove the infected hair cells by approaching through the ear. So simple mastoidectomy means an incision is made behind the ear. We know that the mastoid process is seen in behind the ear. So we are making an incision behind the ear to remove the infected hair cells by approaching through the ear. Through the ear we are approaching and we are removing the infected or diseased mastoid cells. Then radical mastoidectomy means a radical mastoidectomy removes the tympanic membrane and is indicated for extensive spread of a cholesteatoma. So we have seen one of the causative factor for mastoiditis is cholesteatoma or cyst formation or non-cancerous growth inside the inner ear or middle ear. So in that condition, before treating the mastoid or before removing the mastoid, we are removing the tympanic membrane and also cholesteatoma. The eardrum and middle ear structures may be completely removed. Usually, the stapes is spared if possible to help preserve some hearing. So in this surgery, the entire middle ear process also removing that bone. Ingus and malleus also removing, and stapes will be remain or left there. It will helps to continue the hearing with the help of some processes. So we can put some ear implantation. It will helps to continue the hearing. So this is happening in radical mastectomy. So yeah, tympanic membrane will remove, then any cyst formation that also will be removing, and some of the middle ear part also will remove through the incision. Then cortical mastoidectomy means removal of the mastoid hair cell without disturbing the middle ear. Then cortical mastoidectomy means it is focusing only on the mastoid hair cells, removing the diseased mastoid hair cells, but there is no involvement or disturbing of middle ear. So this is all about mastoidectomy. Another surgery is myringotomy. It is a surgical procedure in which a tiny incision is created in the eardrum, relieves pressure caused by excessive buildup of fluid or pus. So it is a temporary management. So that is also a surgical procedure. Here we are making a tiny incision, a small incision is making on the eardrum. This helps to relieve the pressure created inside because of the fluid accumulation or exudate. There is a pressure created inside the eardrum that will be removed with the help of or released with the help of myringotomy, and it will helps to release excessive buildup of fluid or pus for proper drainage of fluid and pus. So that's all about myringotomy. Let us see the postoperative management. Place the patient on bed rest for 24 hours Provide comfortable position. Comfortable position we already discussed. Patient lies with operator ear up. Whenever they are lying, that operator ear, whether it is left or right, it should be come upside. Otherwise, again, obstruction can occur. Elevate the head of the bed to reduce swelling and pressure on operator ear. So whenever they are lying, you have to advise them to elevate the head end so that the proper drainage will be there, and also it will reduce the swelling and pressure. Instruct the patient to keep the ear dry for 4 to 6 weeks after surgery. Avoid heavy lifting, straining, exertion. Do not blow nose for 2 to 3 weeks after surgery to prevent dislodging tympanic membrane graft. So, if any graft is placed on the tympanic membrane, in case of blowing the nose or blowing the ear, so when you are filling air inside the mouth, so there is a chance of going the air, not only chance, the definitely it will go through the eustachian tube, through the nasopharyngeal region, and it will enter the middle ear, and there it will put pressure over the eardrum or the tympanic membrane. So there is a chance of breakage of tympanic membrane. Okay, so that's why we have to avoid blowing of nose or mouth. Then administer antibiotic analgesics and antihistamines according to the doctor's order. We have to provide the medication properly at proper time, and we have to always observe for proper dosage. Then assess hearing acuity by using whisper test, Rennes test, and Weber's test. So these are the tests we are using for assessing the hearing acuity or hearing ability. So whisper test, Rennes test, and Weber's test. I think I have told about Rennes test and Weber's test. And whispers test you can seen in the test book, and I will give you an explanation afterwards. So this three test will helps to identify whether the person is having hearing loss or not. These are the post-operative management. Let us see the complications. It including cholesteatoma, then osteomyelitis, hearing loss, facial paralysis, because if any nerve damage is occurring can lead to facial paralysis, then meningitis and brain abscess. These are the possible complications which can occur in non-treated mastoiditis, or if the mastoiditis is not properly taken care, that can lead to this kind of infections. Let us see the Nasi Manager. Assess the pain for location intensity. Administer analgesia as prescribed to relieve pain. Administer medication as ordered. Provide plenty of fluid. They should take plenty of fluid. Encourage patient and family to use signs of non-verbal communication such as facial expression, pointing, body movement in case of hearing difficulties. So if they are experiencing some of hearing difficulties and even they want to communicate something, you have to encourage them to go for non-verbal communication without the voice. Okay, verbal communication. You all are familiar with non-verbal communication. So with the help of eyes, you can do some communication. With the help of hands, with the help of expression, you can do some communication. So these are the non-verbal communication. So encourage the person for doing signs of non-verbal communication. So this is all about the topic mastoiditis. It is a small topic and a little bit important for your exam. I hope you have cleared the topic. We discussed about definition, then we have seen the what are the causes, then types, then pathophysiology, what are the signs and symptoms, diagnosis, the medical management and surgical management, and what are the post-operative care, and also nursing management. So I hope all of you clear about the topic. So just go through the topic, and if any doubt you can ask me. Have a nice day. Thank you.